Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Ciprofloxacin, also known as Cipro. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. And quickly, if at any time during this video you find the information to be valuable, please consider leaving a like on the video, as it would really help me with the YouTube algorithm. So first, what will we cover in this presentation? We'll start by talking about how ciprofloxacin works. We'll then discuss indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe ciprofloxacin. We'll then discuss examples of dosing, and then stick around to the end where we'll talk about side effects with percentages. So how does ciprofloxacin work? Well, first of all, ciprofloxacin is a broad-spectrum fluoroquinolone antibiotic agent. It prevents bacterial DNA replication, repair, transcription, and recombination. It inhibits topoisomerase 2 and topoisomerase 4. Now, in terms of indications or reasons we would prescribe this medication to a patient, we often see it used in bacterial conjunctivitis. It may be prescribed in gonorrhea or bronchitis. A patient may use this medication to treat an infection of the bone or an infection of the skin or subcutaneous tissue. We may see it prescribed to treat lower respiratory tract infections, urinary tract infections, as well as some other indications. With respect to contraindications or reasons we would not be able to prescribe this medication, one would be if a patient had a hypersensitivity to ciprofloxacin or other quinolones or to any other component of the formulation. And it's also not to be used with tizanidine. Now, what about dosing with ciprofloxacin? So two examples here. One, in the treatment of infection of the skin or subcutaneous tissue. If it was mild or moderate, a patient may use 500 milligrams orally every 12 hours for 7 to 14 days. If the infection was severe or complicated, however, they may use 750 milligrams orally every 12 hours for 7 to 14 days. If a patient was treating anthrax, they may use 500 milligrams orally twice daily for 60 days. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using ciprofloxacin, so we'll go over some of those here now. 2.5% of patients may experience diarrhea, while 2.5% to 3% may experience nausea. Up to 2% may experience a rash, and vomiting may occur about 1% of the time. 1.3% of patients may experience abnormal liver function tests, and less than 1% may experience a headache. Now, for the ophthalmic solution for your eye, some patients may experience a burning sensation in the eye. 16.5% of patients may develop crystalline deposits, and some other patients may have visual discomfort. Now, for the otic solution for the ear, 2 to 3% of patients may experience pruritus or itchiness. Some may experience a superinfection as well. Now, some more rare but serious side effects would be a feeling of nervousness. Less than 1% may experience hallucinations, as well as Clostridium difficile associated diarrhea. That's all we're going to talk about today with ciprofloxacin or Cipro. As always, I'm very thankful you took the time to go by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.